What we're going to talk about now are cuts and serious bleeding for any pet. Now again, we'll use Deco for this one. The simulation here will be she's got a cut to her leg. Now with any cut to a dog or any other animal, we've got a problem with blood loss and therefore going on to shock. Now shock's a subject we're going to cover shortly. Within her body, her heart's pumping blood out through the arteries. It then goes through the capillaries and the organs and back into the body through the venous system. If one of her arteries have been cut, this is the worst type of bleed. You'll see the blood pulsing out. You may need to part the hair to have a good close look and see exactly what the cut is. So what we're using to actually protect the wound and also to stop the bleeding are the pressure dressings. In the first aid kits, they look like this. They come in a plastic wrapper. They're all sterile. So what we need to do to start with is look at the wound. We may need to wash it off with saline or water. Have a good look, see exactly what's wrong so we know what we're dealing with so we can tell the vet. Whole time we're doing that, you need to keep the dog calm. These particular dressings here, you undo them and then you get to the pad. And the pad itself is a non-stick surface. And what that's going to do is go over the wound. The idea of these dressings is they do apply pressure onto a cut. It's like putting your finger into a hole of a bucket. The water will stop. And the idea with this is to really push pressure down to reduce the blood flow. The use of ice packs is very useful as well. Ice will help to constrict blood vessels and reduce bleeding. So all we do with this is we apply it over to the leg. We're going to wrap it round in a minute, but we do not want to do it too tight. Now an absolute last resort with any injury would be a tourniquet. Now tourniquets are not generally used, but what a tourniquet does, it cuts off all blood circulation from where you apply it onwards. Now what we don't want is we don't want this dressing to cut off all the blood supply, because if it's an upper leg wound, we still want to be able to get blood flow going beyond the point. If you put something like a tourniquet on or anything tight around a dog's leg, you're going to have a build up of toxins, and these toxins can be fatal. So make sure when you're putting dressings on, we put it on firm but not too tight. We're going to have a look now at other injuries to the body, other cuts to the body. We looked at the leg. If we look at other areas, maybe there's a cut to the side of her. If there's a problem like that, we need again to make sure we can actually see what the problem is. Make sure there's nothing stuck in there. If there is something stuck into the body, you've got to leave it there. It can do a lot of damage when you remove it. Things when something goes in, lump of glass, it will cut when it goes in, but then it will also cut when it comes out. So part the hair, just very carefully, part it away to actually have a good close look exactly where your problem is. Always be careful just in case, because you might touch it, it might hurt, she might turn around and bite you or snap you. It's only her way of just showing that something's hurt. So just be aware, like now I'd have my arm across, that if she did turn her head round, at least I can keep her down, although I'm not restraining her at all. So once you've inspected the wound, if it's still bleeding, you can use direct pressure on it, the same way as we showed on the leg. This way we can use the pad of the dressing, hold it firmly on and place down. But again, just watching and making sure that she's okay. So just calm her down. So keeping her calm with applying pressure onto the wound, keep it there and just hopefully that will stop the bleeding. You can have a look at the dressing, make sure that the blood has stopped or reduced. We need to get her to the vet as quick as possible. While this is going on, get somebody else to go and get the car ready. Find a way of transporting her. Maybe using a stretcher or a partial shelf of the car, or maybe we're just going to pick her up, or maybe if she's okay, she can walk to the car. So applying pressure. Now this is a chest wound, the same would happen on any part of the body. If you're starting wrapping dressings round, it's very difficult on something like the stomach or here to actually apply a proper bandage. But if she was standing up, we could probably bandage all the way around her chest and keep that pad in place. But again, do not apply them too tightly. We just want to reduce the blood flow. Get her to the vet as quick as we can, and then the vet can have a look, and if necessary, give her any further help, or maybe give her some stitches to hold the wound closed.